Breast milk benefits a baby in many ways, providing the right balance of nutrients, helping to protect against illnesses and infections, and possibly helping with brain development. Many of your baby's physical characteristics are designed to help breastfeeding. The mechanics of sucking require as much contact as possible between the baby's tongue and jawbone and the mother's breast. To maximize contact, an infant's tongue is large in comparison to the size of the mouth, and the cheeks contain fat to help keep the tongue in the proper position for sucking. The same fat pads also ensure that the cheeks don't collapse while breastfeeding, which would reduce the size of the mouth and the negative pressure required to get milk from the breast into the mouth. A newborn's upper airway, through which air enters and leaves the lungs, also supports breastfeeding. A newborn's upper airway is very short, and the epiglottis, a flap of tissue at the base of the tongue that keeps food from going down the windpipe, touches the soft tissue at the back of the roof of the mouth. This combination of physical traits helps direct milk to the esophagus, which carries it to the stomach and reduces the risk of milk going down the windpipe. It also encourages the infant to extend the neck, which brings the lower jaw forward to maximize contact with the breast.
In order for effective breastfeeding to occur, a good latch is required between the infant mouth and the breast. An effective latch requires a few things from the infant. The mouth is widely open with lips that are flared or curled out. The tongue is extended over the gum and under the nipple. The nipple needs to be fully inserted into the mouth, including some or all of the areola. If any of these factors are missing, breastfeeding may become ineffective. Symptoms for the mother include prolonged feedings, painful nipples, and decreased milk production, while infants may exhibit noisy suckling and gas pains. A normal infant tongue has good mobility. Tongue tie is when the tongue is stuck to the floor of the mouth, preventing adequate mobility, which leads to an ineffective latch. The tongue tie may also be hidden under the mucosal lining, a condition called posterior tongue tie. With tongue tie, the tongue tip does not extend over the gum, causing the newborn's gum to chew on the nipple during feeding. Also, the up-down motion of the tongue is hindered, preventing an adequate suck, resulting in decreased milk production. A surgical procedure called tongue tie release can easily correct this cause of ineffective breastfeeding. Upper lip tie is when the newborn's upper lip does not curl up or flare out enough, resulting in loss of suction and the nipple to be incompletely engaged within the mouth. A surgical procedure called upper lip tie release can easily correct this cause of ineffective breastfeeding.